This video, Chapter 8 of Ethics in Information Technology, discusses the impact of information technology on society. Our learning objectives are to examine the relationship between IT investment and productivity growth in the U.S., explore the effect of AI and related technologies on the future workforce, and review the impact of IT on healthcare. The impact of IT on the standard of living and worker productivity is significant. Gross domestic product per capita is the most widely used measure of the material standard of living. The standard of living in the U.S. and developed countries has improved over time, though the rate of change is affected by business cycles. Labor productivity compares the output of goods and services with the number of labor hours used. Growth occurs when output increases faster than labor hours, driven by modern management techniques and automated technology. Innovation is a key factor, and IT plays an important role in enabling it. Fundamental drivers for productivity performance include reducing the amount of input required and increasing the value of the output produced. This involves consolidating operations for economies of scale, improving efficiency, and selling higher value goods and services. Factors affecting national productivity rates include business cycles, the skewing effect of outsourcing, and regulations simplifying hiring and firing. Competitive markets incentivize innovation, while measuring output in service-based economies remains challenging. IT investments can yield intangible benefits alongside tangible results. Artificial intelligence, or AI, is an interdisciplinary field addressing philosophical issues like the nature of the human mind and the ethics of creating human-like intelligence. AI systems encompass the people, procedures, hardware, software, data, and knowledge used to develop computer systems that simulate human intelligence processes, such as learning and reasoning. Machine learning is a type of AI where computer programs learn and improve performance with experience. It consists of a model, parameters, and a learner. The learner adjusts parameters by comparing the model's prediction with reality, repeating the process until the predictions are accurate. Robotics involves the development and manufacture of mechanical or computer devices that perform tasks requiring high precision or those that are tedious or hazardous for humans. Natural language processing is an AI aspect that allows computers to understand, analyze, manipulate, and generate natural languages like English. U.S. healthcare spending reached an estimated $3.2 trillion in 2015, accounting for 17.8% of GDP. Spending is expected to grow, potentially reaching 19.9% of GDP by 2025. Healthcare spending growth is largely due to the aging population, government policy, and lifestyle changes. The development and use of new medical technology also increase spending per person. Controlling costs involves raising patient awareness and managing technology costs. Computerized patient records include electronic medical records, which are used within a single organization, and electronic health records, which provide a comprehensive view of a patient's history shared across multiple organizations. Personal health records are portions of the EHR shared with the patient, and health information exchange is the process of sharing health information between organizations. The Health Information Technology for Economic and Clinical Health Act, or HITECH Act, passed in 2009. It incentivized physicians and hospitals to adopt EHR systems, increasing Medicaid and Medicare reimbursements for demonstrating meaningful use of EHR technology. EHRs, EMRs, PHRs, and HIEs offer various benefits. Providers gain quick access to records and enhanced decision support. Patients benefit from less paperwork and reliable information. Insurance companies see more efficient cost allocation and lower healthcare costs due to reduced redundancies. Clinical decision support enhances healthcare decision-making, increasing quality of care, cutting costs, preventing errors, and boosting satisfaction. The computerized provider order entry system allows physicians to place and transmit orders for drugs, tests, and therapy electronically. Telehealth employs electronic information processing and telecommunications to support at-a-distance healthcare, professional training, and healthcare administration. Telemedicine is providing medical care to people at a different location from their providers. Store and forward telemedicine captures data and transmits it to a specialist for later evaluation, not requiring simultaneous presence. Live telemedicine requires both patients and healthcare providers to be present at different sites simultaneously, often using video conferencing. Remote monitoring, or home monitoring, involves the ongoing measurement and transmission of an individual's vital signs and other health data to a provider. Telemedicine presents legal and ethical questions. These include whether remote physicians need to be licensed in the patient's location, if healthcare systems need a license for a, quote, virtual facility, and if minimum technological standards for transmitted data are required. System certification for critical systems in crises is also a concern. This part summarizes the relationship between IT investment and productivity growth in the US. GDP per capita is the main measure of living standards. Labor productivity compares goods and services produced with the labor hours used. Innovation is essential for productivity improvement, and IT is crucial for innovation. Quantifying IT's benefits on worker productivity is difficult due to the time lag between implementing an IT solution and realizing significant productivity gains. We ask how AI, machine learning, robotics, and natural language processing will affect the future workforce. Advances in these technologies are fundamentally changing how work is done, with some research suggesting 45% of human work activities could be automated. AI systems simulate human intelligence processes, including learning and reasoning. Machine learning allows programs to learn tasks and improve performance through experience. Robotics involves manufacturing devices for precision, tedious, or hazardous tasks. Natural language processing is an AI field enabling computers to understand, analyze, and generate human languages. Regarding the impact of IT on healthcare, U.S. healthcare costs are expected to increase, driven by an aging population, government policy, and lifestyle changes, along with new medical technology. Controlling costs requires managing technology expenses and increasing patient awareness. IT has introduced several record-keeping tools. Electronic medical records are used within one organization. Electronic health records offer a comprehensive view shared across organizations. Health information exchange facilitates sharing electronic health information between organizations. Personal health records are the patient-owned portions of an EHR. Clinical decision support enhances health-related decisions, improving patient care and cutting costs. Computerized provider order entry systems enable physicians to electronically place orders, transmitting them directly to the recipient. Telehealth uses technology for remote medical care, training, and administration. Telemedicine, a component of telehealth, provides care when patients and providers are in different locations. This reduces patient travel and allows providers to serve a broader area. Telemedicine includes store and forward, where patient data and images are sent for later evaluation. Live telemedicine requires simultaneous presence, often via video conferencing. Remote monitoring involves measuring and transmitting vital signs to a healthcare provider.